Good morning, everybody. I think we've got everybody here now. So, Clerk, if you would you please call the roll?
Senator Meredith. Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool. Representative Rourks.
Here.
Senator Douglas.
Present.
Chairman Hart.
Here. We do have a quorum, and first item on the agenda is consideration of the minutes of the May 12th meeting of the committee. There's a motion that they may be considered as being approved. Motion by Senator Meredith, second by Co-Chair Douglas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith. Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool. Representative Rourks.
Yes.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Total number of items on the agenda today are 891 contracts in the amount of $790,566,222.96. All vendors are registered with the Secretary of State's office except for item number 285 on the routine personal service contract green list with Western Kentucky University. Do we have a motion to defer item number 285 on the routine personal service contract green list with Western Kentucky University to the July 2026 meeting of the committee?
So moved. Second.
Motion made by Co-Chair Douglas, second by Senator Meredith. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool. Representative Rourks.
Yes.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Next is the deferred list from the March 2026 and May 2026 agendas. The first item is with Kentucky State University and is number 3 on the March PSC for 10,000 and under goldenrod list. Per the request of the university, they have withdrawn this contract. The next item on the deferred list is with Morehead State University and is number 118 on the May personal service contact green list. Per the request of the university, they have withdrawn this contract as well. The final item on the deferred list is with Kentucky State University and is number 19 on the May PSC for 10,000 and under goldenrod list. Per the request of the university, they have also withdrawn the contract. Next order of business is consideration of the agenda, including the personal service contract list, personal service contract amendment list, memorandum of agreement list, memorandum of agreement amendment list, the Kentucky Entertainment Incentive Program agreement list, the deferred list, and corrections list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection? Motion made by Senator Thomas, second by Senator Meredith. All those in favor vote aye. All opposed, nay. Clerk, please call the roll.
Senator Meredith. Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool. Representative Rourks.
Yes.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. The first item on the pool list is with the Administrative Office of the Courts and is number 1 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record.
Good morning, Margaret Ivy, General Counsel for Administrative Office of the Courts.
Good morning. Ashley Hooker Lane, Procurement Manager for Administrative Office of the Courts.
All right, thank you, ladies, for being here. If you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much, and I believe Representative Petrie has some questions.
Thank you. Good morning. Very briefly, description I've seen is provide funds to assist with programmatic implementation of Fayette District Court Juvenile Treatment Center through the Fayette County Board of Education. Is that right? Okay. Can you just give me an idea of what that is? The description's a little short for us, for me. So how does that operate? What is it?
So I can kind of give you a general idea. I believe that Judge Lindsay Hughes Thurston was going to be on the
Actually,
I'm on Zoom.
Oh,
I'm sorry, I don't mean to interrupt. This is Judge Melissa Moore Murphy from Fayette District Court. Judge Thurston is in court, so I'm the other judge that's here.
she is probably better to give you an idea of what this is.
Perfectly fine with me.
Good morning, everyone. My name is Melissa Moore Murphy, and I am District Court Judge in the 22nd in Fayette District Court. Our Juvenile Treatment Court was created in 2022 by the Supreme Court rules. It is a court's alternative sentencing court for our juvenile court that deals with the mental health of our children that are court connected. This particular and just so I'm understanding your question, Representative Petrie, this particular contract is one that we are partnering with not only Fayette County Public Schools, but we also partner with the urban county government. Fayette County Public Schools provides us an individual that is our program manager for this. That is someone who's already employed with the school system. The money that is in this contract, the $64,000, is money that we receive from the urban county government. The administrative office of the court is the pass-through entity to provide the money to Fayette County Public Schools to pay for the other portion of our program manager.
Very good. So that explains the agency sourcing is what I was looking for. And is the court service rendered in the court system, or is it rendered on site at one of the schools or a school location?
It is rendered here in the court system. Our program manager attends all of our juvenile sessions as well as the family court dockets as well. She receives referrals from our family court judges as well as our juvenile court judges. Her office is here in the courthouse. And so all of the services are here. I will say, she does meet with some of our parents and families in the JDP or John David Price building for Fayette County Public Schools when she's having initial meetings with those families and their phase interviews. But everything is here at the court level.
Got it. And if I may, one more.
Go right ahead.
Each of the cases, are they attached to a juvenile case number? Is that what we're addressing?
Yes. So the young people are all court connected in one way or another, whether that's a truancy, status offense, or a public offense that they may have committed. And this program, or our juvenile treatment court, is set up similarly as drug court. So they are juveniles that have been charged with an offense. And if they meet criteria, which is delineated through our Supreme Court rules, they are referred. Our program manager interviews the child and the family and whether or not they would be able to participate in the program. And then they would go through the 4 phases of our program in order to complete and graduate.
Very good. Thank you very much.
Yes, sir.
Senator Thomas.
Good morning, Judge Murphy. It's good to see you.
Good morning.
Judge Murphy, talk a little bit about the success of your program. You talked about what it does. Can you go into some explanation of the success you've seen with this juvenile treatment program?
Thank you. So we've had the opportunity to present, first of all, as we like to say, that we're an award-winning program. We've received award from the Kentucky Association of School Social Workers. We are also peer-reviewed by the University of Kentucky. We presented in Philadelphia at Council of Great City Schools, but it is a program showing partnership of how we deal with children that may be at risk, or as we like to say, at promise. But we've had over 100 referrals. We've accepted about half of those in our program. And to date, we've had at least 25 of them successfully graduate. Each one of them, and I know the numbers may not appear to be great, extensive numbers. However, each one of them are receiving mental health services, and that's our first goal, is to show our children that there is not a stigma that they should be fighting against as it relates to receiving mental health services, because we understand that a lot of our children that are going through the symptoms that they are going through, that we need to get to the root causes of those issues. We have many of them have coexisting issues, meaning our status cases They are not attending school. They're not on track to graduate. To date, we now have 11 high school graduates. And before they came into our program, they were at least a grade, if not a grade and a half behind. Currently, we have six young people who are participating in our program. They have 4 public charges, and actually one just rolled off because they just graduated from high school last week.
That sounds quite impressive, Judge Murphy. It's good to talk to you. Also, give my best to Judge Thurston. Thank you very
I
much.
will do that. Thank you.
Senator Douglas.
Thank you, Mr. Co-Chairman. I have a couple of questions, if I may, and I'll just throw these out. Primarily, I'm just seeking to understand. First of all, help me understand what, quote, successfully graduate means.
So our program is set up the same way drug court, if you're familiar with drug court program. So we have 4 phases that our children or our juveniles must go through. So each step, we create and craft an individual participant plan. So whether that is they come in, no further offenses, attending school every day, abiding by rules of the home, drug screens. Every child has random drug screens. If they're able to successfully complete those first, we go to the next phase. Second phase is getting a job. And so I can't give you a direct answer for each child, because each one of these young people that come through have a specific one that is unique to them. So if a child is coming into our program and they're coming from family court and it's strictly about their attendance in school, then that's what we're focusing on. We're focused on their attendance and behaviors in school. If it is someone that is coming into our program and they may have committed a theft, we are working on what it looks like to get a job and be a responsible citizen within the community. Also getting them prepared. We've got dual credit, connecting them with BCTC. So when you say successful graduation for us is one, they've not committed any new further offenses of the law. They're graduated from high school, or they have returned to on level and returned to their home schools. And I'm not sure if that's answering your question, but each child we have in our program has a separate program that they must work through, and they must complete all 4 phases before we consider that they have graduated.
May I have a follow-up,
Yeah,
Mr. Chair?
go right ahead.
Thank you very much. Thank you very much for that answer, and I'll try to be brief here, because this leads me to a second question and a third, and I'll just throw both of these out there. Number one, who pays for the drug screens? Because we're doing these repetitive drug screens, and I'd just like to know who's paying for the drug screens. And number two, what are the caregivers' involvement in terms of, because we've got a pipeline that is continuous, and the pipeline begins with our caregivers.
Mm-hmm.
And if the purpose of the program is truly we can either help that particular individual that's already gone down the pipeline, or we can try to stop the matriculation or slow the matriculation through the pipeline. Does this program do anything to affect the matriculation or those who are entering the pipeline? So 2 questions: who pays for the drug screens, and does this program do anything to affect the matriculation into the pipeline?
Thank you for the question. We, as I stated at the beginning, part of our partnership is also with the Urban County government. So the Department of Social Services within the Urban County government partners, and specifically their Division of Youth Services pays for the drug screens. And that has been ongoing for the last 2 years, and that has been built into their budget. Additionally, as you discussed about the caregivers in the pipeline, as we know, there is this school to prison pipeline that we hopefully are all attempting to negate. The reality is that we're helping families. We partner with one of the initial steps of the interview is that it's not just the kid saying that they want to participate, the family has to be willing to participate. So we do classes for the parents. We do classes in education training for moms and dads. We help them with the services that they may need to ensure that their children aren't coming back here. Because we understand that it's not just a child that wakes up and says that they want to commit an offense, but it's their environment. So we have families. You can check out our stories on WKYT. We have success stories where it's not just the children that we've helped, but we've also helped mothers make their way back into getting their nursing degree. So we understand that it is not just let's fix a child per se, quote unquote, but it's the environment. And that means dealing with the families and any other root causes that may have brought them in front of us.
Thank you, Mr. Chairman.
If there's no other questions, do I have a motion to consider the contract review without objection? Motion made by Senator Thomas. Do I have a second? Second by Representative Rourke. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas,
May I explain my answer, please? Mr.
Yes, you may.
Mr. Thank you. I vote aye. And I will tell everyone in this room today and the public that I'm not surprised that this was pulled. I fully expected that. The Fayette County Public Schools has been under intense scrutiny by this legislature, I think unfairly, over this year. Just last week, the Fayette County Public Schools held 6 high school graduations. The public should know that the graduation rate for the class of 2026 was 95%. Now, let me put that in context for you, okay? 95% is higher than the statewide average. The statewide average is 88%. 95% is higher than the national average. The national average for high schools is only 85%, okay? So Fayette County exceeded both the statewide average and the national average in terms of its graduation rate, okay? This program receives no state funding. Doesn't even receive state funding from the judicial budget, okay? This is financed by the Fayette County Public Schools, who wants to see its children graduate. These are public students. These aren't private students. These are public students. And of course, the Fayette County, Urban County government, because they want to get young children off of drugs, get them to graduate and moving on to have a successful, and I use that word intentionally, a successful life. Okay. This is a great program. You've just heard Judge Murphy articulate that very well. Okay. This program does good for the children. It does good for our society and our community. So having said all that, that's why I vote aye for this program.
Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Senator Douglas.
Aye, but explain my vote.
Go right ahead.
Thank you, Mr. Chairman. You know, one of the things I harp on this a lot in this committee as one of the co-chairs is we're being asked to review contracts and assess whether or not they're in the best interest of the people of the Commonwealth of Kentucky. It's not personal. I say this over and over. It is not personal. And as far as being unfair, I would suggest if I've got a school system that is looking to borrow over $100 million, my best deal is to be quiet while the Attorney General and the auditor do their jobs and not take sides, because I represent the people of the Commonwealth of Kentucky. And as long as I'm in this position, I will always defend this stance of defending the people of the Commonwealth of Kentucky who are paying taxes and who expect a good return. But I vote aye.
Chairman Hart.
Yes. Motion carries. Thank you all so much for being with us.
Thank you.
Next items on the pool list are with the Auditor of Public Accounts and our numbers 11 and 12 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record.
Good morning, Mr. Chairman and members of the committee. My name is Alex McGarrah, and I'm here on behalf of the Auditor's Office.
All right. Thank you so much. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. And I believe Co-Chair Douglas has some questions.
I do. Thank you very much, Mr. Chairman. Just very simple questions. I know I pulled number 11. I didn't know about 12. But how much of the monies that's being asked for is expected to be used?
You mean so in
Contract number 11.
Yeah, so in 2025 for the contract 11, which is a contract with Vantage Point Solutions to help us conduct a full-scale examination of the Kentucky Communications Network Authority and Kentucky Wired Network, this body appropriated the auditor's office a total of $1.5 million to conduct the examination, but we have negotiated with Vantage Point, who's going to be helping us do this examination for only $700,000, so less than half the amount that the General Assembly appropriated.
What have we found out so far?
Well, we found out a lot, Senator. I think our plan is to issue a report before this body's 2027 regular session, so that this body has all the information it needs to make the policy choices that it deems worthy and necessary for the best interest of the Commonwealth of Kentucky. The list right now is extensive. We're in the drafting phase of our report, and it's hard to talk about specifics right now without jeopardizing the examination. I know people don't like hearing that, but I would just ask for you to be able to wait for our release of the report, and I think you'll find it very interesting and helpful to this body to decide what to do.
Well, thank you very much, because you've answered my second question.
Perfect.
I do appreciate that. Can I ask about 12?
Yeah, go ahead.
Okay. Thank you, Mr. Chairman. Perhaps you can help me out.
Sure.
Our contract number 12 funds to conduct a special examination, and I read on down with the explanation, and it talks about provide a detailed outline of concerns about the use of taxpayer dollars for certain investments contrary to Kentucky's interest within Kentucky's various state administered retirement. Could you help me out a little bit with that? 'Cause
Absolutely.
that's a little convoluted.
Yeah, absolutely. It's a convoluted examination, so I fully anticipate that question. So on October of 2025, we received a letter from the Legislative Oversight and Investigations Committee asking us to look into the investment managers that Kentucky's 5 retirement systems use to make sure that our pension obligations are fully funded and that that the funds that are being invested are done so in the best interests of Kentuckians and the Kentucky pensioners that have earned this money. The concern from the Legislative Oversight Investigations Committee is that the Commonwealth is using investment managers that are investing in what has been colloquially referred to as ESG, environmental, social, and governance. These are a set of factors that, for example, the Northern District of Texas just ruled are in violation of investment managers' fiduciary duties that are owed to the various retirement systems that states like Kentucky are that the investment managers. It's a violation of their fiduciary duty to invest in ESG factors, and it's costing states across the country millions, if not billions, of dollars for their pensioners. So LOIC has asked us to look into whether the investment managers that the Commonwealth contracts with for its 5 retirement systems are investing according to these factors, or if they are upholding their fiduciary duty and responsibility to Kentucky and the individuals who are receiving pensions from Kentucky to make sure that they're maximizing their wealth. That's the goal of the pension system and investments, is to maximize wealth. No other political or any other type of factor should be used by an investment manager to invest, to guide their investment strategies and decisions. BlackRock is a well-known investment manager that a lot of states use. They were the ones that were just successfully sued in Northern District of Texas for violating their fiduciary duty to the state and the pensioners to maximize their wealth, which should be the goal of every pension system and every investment manager in the strategies they use to make sure that our pension system is fully funded and obligated.
And if I may, what is your charge to do with that information once you've collected that information?
Give it to you all to decide whether you think that these investment managers are worth using for the Commonwealth of Kentucky. And the reason I said this is kind of a convoluted investigation is normally when we are doing an investigation, we are examining the conduct of the government entity. But in this case, the 5 retirement systems have been so far very helpful in working with us to identify whether these investment managers are working in the best interest of the Commonwealth. So I think with their help, we'll conduct our investigation with the help of the contract that we've enlisted to do this, with the expertise to do this. We can give you all the information that you need to determine whether these investment managers are truly acting in the best interest of Kentucky.
Thank you very much. I appreciate that answer. Sometimes we just need to get certain things on the record because sometimes there are misunderstandings or misreadings, and I just want to make sure that we all are looking down the same straw. Thank you very much,
Absolutely. Thank you.
Mr. Chairman.
I think Representative Rourke, you have a question?
Yes, sir. So you answered the question about Contract 11, that the report will be coming before the legislature sometime at the end of the year before the 2027 legislative session.
That's right.
What about Contract number 12? When do we expect to see those findings?
That's a great question, Representative. I think we are on track to do the same with that one. It's going to depend on how willing the investment managers are in working with us and giving us the information we need. Like I said, the retirement systems have been great so far. It's just we may need to look deeper, and that's why we've enlisted some help here, because the individuals that we're contracting with have extensive knowledge of kind of the inner workings of these investment managers, and they know how to dig in and ask the questions that need to be asked, and also look at the documents that need to be looked at to really understand what these investment managers are doing for our retirees.
Was there a deadline given by the Legislative Oversight Committee?
No, not by LOIC, but we have sort of imposed a deadline of, I think, like October, I believe, is the deadline. But again, we've put language in the contract to make that deadline flexible, so that if we run into roadblocks, we can push it out and then give this body again what it needs, hopefully in a more timely manner than that. But at least for the upcoming, or at least for the 2028 general session, if we can't get it done before 2027.
Thank you.
But we know you'll be there by 27 because we believe in you.
I appreciate that, Senator. Thank you.
Senator Meredith.
Thank you. And just a very quick question. You referenced the Texas litigation,
Yes.
and that's kind of prompted this. Just point of information, was there a civil penalty associated with that decision?
So, Senator, that's a great question. It was in. So the judgment was at the summary judgment phase where liability was decided, but I don't think damages had been decided yet. I think the liability portion has since been appealed to the Fifth Circuit, but I don't think there's been damages that have been established yet. But based on what the briefing has shown, could be billions of dollars. So, yeah.
But that's the nature of our question. We'd certainly like to have additional funds for our retirement program. So thank you, Mr. Chair.
If there's no other questions, do I have a motion to consider the contract review without objection? Second. I have a motion by Senator Meredith, a second by Co-Chair Douglas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Senator Douglas.
Point of clarification, is this
Go right ahead.
for one contract or is this for both the
This will be
contracts?
for both of them.
Okay, thank you. Aye.
Chairman Hart.
Yes, contracts or motion carries. Thank you so much for being with us.
Thank you very much.
Next item on the pool list, or next items on the pool list are with the behavioral health, developmental, and intellectual disabilities, and our numbers 13 and 14 on the routine PSC green list, and number 117 on the MOA routine pink list. If representatives are here, please identify yourself for the record.
Good morning. My name is Jennifer Moore, and I'm an assistant director within the Department for Behavioral Health, Developmental, and Intellectual Disability.
Yes, good morning. Alan Brenzel, and I serve as the medical director in the Department of Behavioral Health, Developmental, and Intellectual Disabilities.
All right, thank you all so much for being with us. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much, and I believe Representative Petrie has some questions.
Thank you, Mr. Chair. Good morning. 13 and 14 is what I'm looking at, and so just help me understand what each one of those is. How does it operate, just generically? Assume that I know nothing about the space. How would I understand that?
So, I mean, I'll speak from the standpoint of the purpose of the contracts, and my colleague can speak to the finances, but I think, as you know, the Department of Behavioral Health, Developmental, Intellectual Disabilities has oversees 11 state facilities. We have a variety of operating relationships. These contracts are to provide medical staffing to our state psychiatric facilities. The process is that we have constant difficulty hiring directly into state positions due to shortfall of psychiatrists in the state. And so we enlist and submit out an RFP to contract with providers who provide what we in our field know as locum tenens providers. We overall, I think, have 6 of these contracts. I think you pulled 2 of those today. These are contract authority amounts. We typically don't spend the full amount. And I think actually the 2 contracts that are here today, we've not expended any funds in most recent years.
So 2 things really quickly. One, in reverse order. So upon invoice for services, the money's paid out and the fund remains available to continue that.
Correct.
All right. Number 2, back to the earlier part, medical staff, is that clinical, or is that assistant to clinical, supervisory? Ratios? Is it all clinical support? What is it?
It's generally all clinical direct care service, although we do also have a medical director function in each of our facilities. And so we have utilized this to provide administrative assistance, but primarily this is to provide direct patient care to statutorily required services that we provide for those under civil commitments.
So the administrative support or things outside the clinical direct would be minimal.
We would not contract for administrative support through these contracts.
Gotcha.
Mainly psychiatrists.
I'm sorry.
Contracts are
Physicians.
mainly for psychiatrists.
Very good. And are these done in person, services rendered in person, telehealth, combination? How does that happen?
Combination. Our goal is to have on-site psychiatry services, although there are times where we provide a hybrid model where we have psychiatrists that are providing
50-50,
telehealth.
30-70, 80-20?
I would say 50-50.
Okay. Everyone that's providing clinical support's licensed in Kentucky or has some kind of approval?
Absolutely. They have to have an active Kentucky medical license. That's part of the contract. And then each of these facilities has a governing board that consists of our department as well as the commissioner, and all of them are credentialed through the medical staff committee of that hospital and then voted on and approved by the governing board.
And you mentioned 6 contracts, 2 of which we're looking at. Is this a normal process and normal use for rendering services, clinical services, by hiring outside firms? And I would say it that way. Do other states do similarly? Kentucky is uniquely situated. Is this normal among the states?
I'm a member of the National Association of State Mental Health Program Directors, has a medical leadership group, and I think unfortunately the state of the supply of psychiatrists makes this a rather routine practice across other states, and there's a lot of discussion about the lack of psychiatry and the lack of availability, and so this would be a typical process that other states utilize.
If I may, one more.
Go right ahead.
And it's going to be a softball over to you. Your last point, and I led you right up to it. Is there something that the General Assembly, the executive branch, nonprofits, other entities can coordinate better in a simple way that you could explain this morning, better to grow pipeline of those clinical professionals you just mentioned we have a deficit?
Well, thank you for mentioning that, because I have some statistics briefly. I saw a report recently where Kentucky today, or the United States today, has 37,000 psychiatrists, and we need 52,000 psychiatrists. So the state supply of psychiatry is at about 72%, but projected by 2038 will be at 50% of the projected need of 36,000 psychiatrists. The disturbing thing in that report was Kentucky. By 2038, we'll have 25% of the supply of psychiatrists we need, the lowest in the United States of America. So Indiana and West Virginia are right there with us, but we'll have less than about 25% of the needed. And so the things we are going to need is to promote people going into psychiatry as a profession, to work with our universities to expand their psychiatry residency programs. We're gratified that our partners at the University of Kentucky have increased their slots. But there are loan repayment issues that make psychiatry detrimental in terms of folks taking the additional training. as well as I think we need to look at promoting and funding more rural psychiatry slots. Some of our hospitals are located in rural areas and rural psychiatry programs. We're exploring some federal funding that is being made available that a university could apply for that would allow them to add. We're very excited. The University of Kentucky has hired a new Department of Psychiatry chair from North Carolina, Dr. Panaskovich, and he's very interested in bringing some of the things he's used in North Carolina to increase the availability of psychiatrists and train more psychiatrists. So we're looking forward to that.
Very good. Thank you for the leeway. And we did not coordinate that.
We did not.
I think Senator Meredith, you have some questions?
Thank you, Mr. Chair. Yeah, my questions are the same line as Representative Petrie. Unfortunately, we approve a lot of locum tenens contracts. I mean, millions and millions and millions, and that's the most expensive form of labor that you can have in healthcare. So I'm curious as to how we're monitoring this throughout state government. For this particular sector, what's the turnover rate?
I would have to get back to you. I think we have a series of stable locum tenens that provide ongoing services, and we always make effort to hire those people directly if that's an option for those individuals, because you're absolutely right, the cost of locum tenens is extensive. However, in also hiring someone into the state system with the pension cost and additional fringe benefits is also very expensive. And psychiatry salaries are accelerating based on that lack of supply. But we, at each facility, there's a medical director. Their job is to create a stable medical staff. We, again, referencing our colleagues at University of Kentucky, is a place where, and Lexington, you would think it would be easy to recruit psychiatrists. They just recently got rid of their last locum tenens at Eastern State Hospital, our partner. And so this is primarily used in our Western State Hospital in Hopkinsville, Kentucky. That's where we have the most difficulty. But we monitor, the governing board monitors, each facility is given an operating budget. Their cost of their medical staff is within their operating budget. It's monitored by the governing board. We are also looking at using additional advanced practice practitioners, nurse practitioners, physician assistants. This is another way we can extend the ability of that psychiatrist to supervise more clinicians, and they cost somewhat less, although they're getting more expensive as well. But we monitor the operating budgets of each facility, and we do attempt at all turns to hire people directly whenever possible and move them off these contracts.
Would you have any idea what the current vacancy rate is for these 11?
Vacancy rate for the facilities?
Yes.
I think we're generally fully staffed, although I just was notified of a physician retiring as of June 15th, and so we'll be at least one more down at Western State Hospital. But we generally, with the combination of these contracts, we're able to adequately staff but in terms of those numbers, we probably have 4 or 5 that we would love to turn into directly hired psychiatrists.
Well, thank you, but I'm not sure we're looking at the same vacancy rate I have in mind, because you're including the locums that are filling those positions.
Yes.
I'm more curious as to what the vacancy rate would be if you didn't use the locums.
I gotcha. I can work on that and get you that if that's.
I appreciate that.
I think that would be calculating the number of locums, because that would be the number of folks that we would rather have in state.
Well, we can always assume that the shortage of healthcare professionals drives a lot of this, but in some instances, it could be work environment. So it's multifactoid, and that's why I pose the questions. And certainly it's got strong budget considerations for us. And Chairman Petrie, I think this is something we really need to give a look at the next budget cycle, and because it's a challenge. But thank you. Appreciate the information.
Senator Douglas.
Thank you, Mr. Chairman. A question and a statement, if I may, Mr. Chairman.
Go right ahead.
Okay. My first question is, with locum tenens, who's paying the malpractice costs?
So that is generally built into the cost of the contract of the service. So they would have to have that as part of the contract with the locum tenens services, and when they provide a psychiatrist for them, that would be included in their fringe.
And they're being covered only when they're providing that particular service for whatever institution that you're going to assign them to, correct?
I would assume, but I would have to ask because there could be a tail policy as well. Once they leave, I would have to check if there's a tail policy that.
Well, my concern is that many of the locum tenens also provide services at other places off contract. And I would ask that you take a look at the contract and make sure that those contracts for malpractice aren't being extended to off-site services.
I got you. Okay.
Because that's a
just apply to our facilities.
yes, sir.
Okay.
That's a real concern. The other thing I'd like to talk about is, you know, we do this all the time. We talk about some of our other non-physician people that we want to put in those, and we talk about how, well, they're getting as costly as physicians, and then we don't want to discuss payment parity for physicians, and we ask why physicians don't want to do that, which is, with all due respect, one of the dumbest conversations that I hear often. And we look at the same thing when we take a look at our healthcare desert, and we wonder, why don't people want to be there? And I can tell you, medical school is not a whole heck of a lot of fun, and residency isn't either. So I just want to, I'm going to continually throw that out. And I agree with you, Senator Meredith and Representative Petrie. I think these are conversations that we in the General Assembly do need to be having. Thank you very much. Thank you, Mr. Chairman.
If there's no other questions, do I have a motion to consider the contract review without objection? A motion by Senator Meredith, a second by Co-Chair Douglas. All those in favor vote aye. All those opposed vote no. And clerk, before you call the roll, this would be a motion to approve 13 and 14. We'll do 17 on a separate motion. So with that being said, clerk, please call the roll.
Senator Meredith. Aye. Senator Richardson. Senator Thomas. Aye. Representative Bauman. Representative McCool. Representative Rourks.
Aye.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Now do I have a motion to approve contract number 117 on the routine MOA? Okay. All right. I'm getting ahead of myself. We need to have the discussion. So with that, Representative Petrie, I think you had some questions on 117.
I am sorry, I don't have a note on that one. Okay, that's why I don't have a note on it. Tell you what, you may have to come back to me in just a moment on this one. What was the number again? Because I was looking at the wrong.
Contract 117 on the pink list.
Oh, yeah. I think I've got it. All right. So around 17.6 million is what I'm looking at.
Yes.
General fund source. Can you give me some idea what this is about in a short, brief, concise way? What are we doing?
Yeah, this is a staffing contract for the Kentucky Correctional Psychiatric Center, and they currently employ 72 staff under this contract, ranging from the medical director, physicians, IT staff. There's several different disciplines that this contract.
Very good, and I want to get this out of the way first. 7 counties. Is this the same 7 counties or an affiliate of the bankruptcy case that's been going on for over a decade at this point?
Yes.
Still not resolved?
Not that we're aware of.
I can address that.
Could you please identify yourself for the record?
Absolutely. Excuse me. Hi, Wesley Duke, General Counsel with the Cabinet for Health and Family Services, and Representative Petrie. That case is still ongoing. It is pending at the Western District. Again, it's gone back there on an appeal from the bankruptcy decision by the Pigeon Authority, and it's all briefed and pending before the court at this time. One of the last times I was here, I know you and I had a dialogue, and you asked me to look into that. I've had a conversation with 7 counties' attorney and counsel for them as the status of it. I also reached out to counsel. General Counsel for KPPA to discuss the case, and he respectfully declined to discuss it with me given the pending litigation, which I totally understand, and he was very, very respectful about that. So that's the current status.
Very good. Similar question to the earlier one, staff. Is this mainly clinical support, or is this staff support, administrative support, proportions? for 17.6 million?
It's a combination.
It's more broad than, particularly than like a locum tenens contract. So this is a significant number of positions. They are primarily clinically focused and clinically trained, but it would include psychiatrists, psychologists, direct care, behavioral health technicians, but there's also some administrative support, IT, and other things. So this is a significant number of positions, but they typically have expertise in providing clinical care, because this facility is our forensic psychiatric hospital. We receive no reimbursement from Medicaid for this, so that's why it's general fund dollars.
How many staff or how many personnel are included in this contract?
There's 72.
72.
72. And they're all direct clinical care with appropriate degrees, not much administrative and not much assistant support thereafter?
There are some, but not all of the positions are direct care.
Well, this goes back to a point earlier. So we're looking at the most expensive way to deliver this.
But I don't think there would be any like administrative assistant support. These are folks who provide direct care to like staff.
Contract versus employee.
Yeah, I see. Yes.
Yes.
But
is there any other way to do this?
We have not been able to successfully recruit these level of clinical and independently licensed physicians into state positions. And so this is as I mentioned, we have multiple different models for the operation of our state facilities. This is a state owned and operated, but we use a contract staffing for the clinical support.
And if I may, how long have we been doing this, contract staff, as opposed to majority of these 70 by employee relationship? How long have we been using contract?
I've been in my position 16 years, and it way preceded myself. So this has been going on for probably in excess of 25 years, I would imagine.
So this is the way it operates. This is not the exception. This is the rule.
For example, we have one relationship with UK where we contract for the operation of the full facility, Eastern State. We have a partnership with ARH where they operate one of our facilities. We operate ourselves, Central State, Western State, KCPC, but we use partners to staff the clinical side. So
and how long has 7 counties been engaged in this contract on the other end?
Indefinitely, as far as I know. But
it's
more than 10 years?
Yes.
More than 20 years? Probable?
I've been here 16 years, and it's been in place prior to my arrival.
Okay. All right. Thank you.
All right, Senator Douglas.
More of a statement, Mr. Chairman. As everybody knows, I like to do a little bit of calculation, and that comes to about $244,445 per employee. I think we need to look into this. I think we need to find a better way, because liars may lie about numbers, but numbers don't really lie. So we need to take a look at that. Thank you, Mr. Chairman.
All right. If there's no other questions, do I have a motion to consider contract review without objection? Motion by Representative Rourke, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative.
I didn't say. let me respond first.
Okay.
Mr. Chair, I vote aye, but I want to explain my vote. I must tell you, I've been very supportive of 7 counties, but I have to tell you, Representative Petrie does raise a good point. I mean, to be doing this continuously for 20 years on a contract rate is we're wasting state money doing that. It's far better to pay the psychiatrist. Again, I would agree with what was said earlier. A good rate, a good market rate for their services. But I have to believe that would be cheaper than $244,000, which is the math that Senator Douglas highlighted. I would urge you, and Wes, I would urge you as well, to take a look at this and see if we can change that mindset, see if we can change that approach. Because ultimately, I will acknowledge that we are stewards of taxpayer money. I mean, that's one of our key responsibilities. And we've got to look at a more efficient way of using taxpayer dollars. And doing this routinely year after year after year after year, it's not a good use of taxpayer money. It's inefficient. So I do concur in this instance with what Representative Petrie has said, what Senator Douglas has said. But I do vote aye.
Representative Bauman, Representative McCool, Representative Rourke.
Aye.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Thank you all so much for being with us.
Thank you.
Next items on the pool list are with the Board of Veterinary Examiners and are number 17 and 18 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record.
Michelle Shane, Executive Director for the Board.
Carmen Igrino, outside counsel for the Board of Veterinary Examiners.
Could you check to see if the green light's on? Oh, there you go.
I'll do that again. Carmen Igrino on behalf of the Board of Veterinary Examiners, outside counsel. I will take this opportunity as well to congratulate Senator Meredith on Kentucky Eastern District's newest judge. I worked with Chad and for Chad for years, so congratulations to you.
Thank you very much. Appreciate it.
All right. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. And Senator Meredith, I think, has some questions.
I do, and it's more for educational purposes. I really don't have any problem with the contracts themselves. I'm assuming both these individuals are veterinarians?
They are, sir.
And I'm just trying to understand how the system works. You're an independent agency, state government, but it falls under the Cabinet for Public Protection.
It's actually an independent agency, not connected to the Public Protection Cabinet. There was a time that the Public Protection Cabinet provided administrative support. That's now done all in-house through Ms. Shane and her staff. To your point about a question about how it works, this board, like nearly every other professional licensing board, maintains a subcommittee of the main body, collegial members of the profession. It includes as well a public member, just a citizen at large. A subset of that group composes the grievance committee, which investigates complaints against the professionals who are licensed by the board. And that grievance committee would essentially employ and assign tasks to the investigators who would go out and assess and investigate the grievance that's made against either the veterinarian or the vet tech, and then that's reported back to the committee, which makes recommendations to the whole. That's a very concise overview of the process.
Okay, I appreciate that. And the reason I pose the questions is under the Cabinet for Public Protection, there's a lot of licensed professionals that report to them, but there's many that do not report to them, but that reporting is an administrative function. And we had a situation just recently where an agency waived licensure requirements for their people, and Attorney General said, you can't do that, but nobody knew that it was occurring. So I'm concerned about the communication between independent agencies back to state government to get the assurances that everyone's doing their job.
Absolutely, sir. And of course, I think every professional licensing board is aware of that instance and has been following it closely. As with every collegial body that's constituted by this body, the board meets in open meetings. All of its votes are taken in public and are recorded in the minutes. And I can assure you there's nothing like what occurred in that circumstance.
If someone had a complaint about action not being taken against a veterinarian, who would they go to?
Probably to you all, at least once, probably to the governor's office, and that does occur from time to time. As you all know, the board does take seriously its investigative role, but there are those circumstances in which a grievance is just simply, it's not affirmed, or the investigator finds there's not really a there. That doesn't always address the very real concerns or feelings of the individual who's bringing the grievance, who may feel wronged. But there are those circumstances, one example comes to mind. Bedside manner. I know you were in the hospital industry for years. Bedside manner is not something that the board regulates. And so there may be those circumstances in which perhaps it wasn't a great bedside manner, but that's not something that we can do anything about. Certainly there are, ill feelings and things that they should work through, but that is a circumstance where that you probably will hear from that individual if that were to occur. But it's not something that the board could take action with.
I certainly understand that. And obviously this is going to be a conversation for the discussion statewide. So I appreciate the information today, and I don't have any problem with the contracts, Mr. Chair.
All right, I have a motion by Senator Meredith. Do I have a second? Second by Co-Chair Douglas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Aye. Representative Bauman. Representative McCool. Representative Rourke.
Aye.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Thank you all so much for being with us today.
Thank you.
Thank you all. Thank you.
Next item on the pooled list is with the Department of Education is number 29 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record.
Good morning. My name is Karen Worth. I'm with the Division of Budgets and Financial Management at the Department of Education.
Matthew Courtney, I'm a policy advisor at the Kentucky Department of Education.
All right, thank you all so much for being with us. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you all so much, and I have a couple questions. First one, was this contract, did it go through the typical procurement process and competitively bid and everything?
It did, yes. We did an RFP for this. We actually had 5 applicants, and this particular person was chosen as the best on after scoring and negotiations were done.
All right. How many federal grants do you anticipate will be processed with the contracts?
We have
just an estimate.
Yeah, we only use this service for external reviewers. So any reviewers that come in from school districts, say we have McKinney-Vento, which is a federal grant. We have a large number of applicants for that, and so we'll bring in outside reviewers outside of the department, and we can use this service to kind of train those reviewers on what to look for in the applications and to keep them on track. As you all know, a solicitation is a very timed process. So I know McKinney-Vento is federally funded, and I know 21st Century is another one that's pretty large that we do utilize this service for.
Okay. And that kind of, on average, about how many hours will the vendor spend working on a grant per se?
If we do 2 large ones in a year, it may be 30, 40 hours. They do long days, but their review process is short because, you know, you have post date, then you have questions come in. I mean, it stays on a very tight timeline, so it's not an extended period of time.
Okay. And the $55,000, is that paid in a lump sum or upon receipt of invoices?
No, just invoices as far as time worked.
Okay.
Yes, sir.
Let's see. If I'm not mistaken, KDE has a grant division with several full-time employees. Is this something they could do in-house, or?
You know, and we've talked about that, but we feel like with the RFA process and the RFP process that we want to keep the integrity of that process. We want to keep that process completely. We don't want any type of display of favoritism or anything to that. So by bringing in an outside person, we feel like that's the best way to handle it.
All right, thank you. Is there any other questions? If not, do I have a motion to approve the contract as reviewed?
So moved.
Have a motion by Senator Meredith. Do I have a second? I got a second by Representative Rourke. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Aye. Representative Bauman. Representative McCool. Representative Rourke.
Aye.
Senator Douglas.
I better explain my vote.
Go right ahead.
Thank you very much. I really appreciate keeping the contract integrity. But one of the things that we do here in the Commonwealth, and I'm sure it's not just the Commonwealth, it's in other states, is that we produce a lot of really good people, and then we don't really utilize their expertise because we're afraid other people might see us as cheating or might not, you know. And I would love to see us get back to some semblance of honesty and respect and expectation and accountability. But I do appreciate your answer. Thank you, Mr. Chairman.
Okay, go.
Chairman Hart.
Yes, motion carries. Thank you all so much
Thank
for being with
you.
us today.
Appreciate it.
The next items on the pull list are with the Department of Veterans Affairs and are numbers 37 and 38 on the routine PSC green list. If the representatives are here, please identify yourself for the record.
Donna Scott, Deputy Executive Director for the Office of Kentucky Veterans Centers.
And Juan Renault, Deputy Commissioner, Department of Veterans Affairs.
All right, thank you all so much for being with us. Would both of you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. And Representative Petrie, I believe, has a couple questions.
Thank you very much, Mr. Chair. Good morning to everybody. The two contracts, 37 and 38, agency 100% paid upon receipt of invoices, just so we understand the mechanisms to provide funds for outside medical services as needed for Western Kentucky Center as well as Radcliffe. That was the difference between the two contracts. Help me understand why we need the contracts, relatively small, but why we need the contracts. What outside emergency would take place that would necessitate this contract?
I'll let LaDonna answer that. LaDonna, please.
Yeah, thank you for that question. Both of the contracts that we're talking about are used very little to none, but we do have those occurrences those things that occur, I guess, from residents who may need orthotics. We may need to go to the local durable medical equipment company to get a brace. We may need to go to the local pharmacy to get a specialty med or medication before we're able to get it from our contracted vendor. So they're used very infrequently, but we do like to have those services available in case the veterans need something.
Very, very good. That's helpful. This follow-up is, are we able to bill or invoice anyone for those emergent needs, such as some other kind of federal fund source or other insurance, private insurance, veteran benefit, anything, or are these just straight dollar figures that go out because of an emergency and no way to recoup?
No, we do not bill for those. And once we do submit the veterans insurances to those places, but if we're looking at durable medical equipment and stuff like that, the facility is responsible to pay for those. So we do absorb that cost. But once you look at how much has been spent in the last couple of years, it's very minimal, probably less than $500 for both contracts combined. So again, it's just emergent only. But if they're getting pharmaceuticals and things from our primary provider, then yes, their insurances and things are being billed for that.
Very good. That's what I needed to know. And you're anticipating my next question of how much we're actually using. And from year to year over the last 6 years, for example, would we average $500 or $1,000? And are we still contracting for $120,000 during that same time period?
I know for the current years that were the fiscal year that we're in, the 24 through 26, I believe the total contract dollar amount has not changed. It's been the $120,000. I'm not sure I can get you information back 6 years ago, but right now, I can just speak to the current fiscal year we're in, and again, both contracts total together have been less than $500.
Right, Mr. Chairman, if it's appropriate for the committee, I would ask that we do receive what has the contract level been for the last 6 years, as well as how much of the contract has been expended during that same time period, just so we can get an idea of utilization.
Okay.
Thank you.
Representative Works.
Thank you. So with it being 120,000 that could potentially be used, is there any kind of unforeseen circumstance that we could incur that would get us to that threshold, and what would that be if there is that potential?
See that as being a potential to get to the $120,000. You could have those veterans who are admitted from maybe a hospital setting who require a specialty mattress that we can't do. One of the facilities may not have in-house. So we may look at doing a rental from a local durable medical equipment company. They're just very infrequently incurred expenses. So I really don't think we'd ever get to the 120. I'd be real surprised if that happened.
That's a great example. But that's one of my cautions, though, is that if this number were to be lower in the future, what I wouldn't want to do is that we lower it so much that we don't have that flexibility for the veterans. So just wanted to be cautious of that as well.
Oh, absolutely. Absolutely. And I think that's why we just generally just keep it at that level. You know, we don't know. I think there's a potential for anything to happen, but for the most part, you know, it's going to be below the 120,000.
And do those funds carry over from one year to the next?
For the length of the contract.
Okay. Thank you.
Is there any other questions? If not, do I have a motion to consider the contract review without objection? Motion made by Representative Rourke, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Baumann. Representative McCool. Representative Rourke.
Yes.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. Thank you all so much for being with us. The next item on the pool list is with the Department of Workers Claims and is number 49 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record.
I'm Dale Hamlin. I'm the Assistant General Counsel for the department.
Good morning. My name is Scott Wilhoit, and I am the Commissioner for the Department of Workers' Claims. Good morning, y'all.
Thank you all so much for being with us. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
Thank you all so much, and I believe Senator Meredith has a question.
I do. I claim legislative ignorance, just trying to figure out how things work. And this is a $4.4 million contract. And under the contract description, it says serve as a third-party administrator for the following and has a list of various companies.
Yes. Oh, okay. Do you want the long answer or the short answer? The short answer is the commissioner is required to pay compensation benefits to employees injured prior to March 1, 1997, whose former self-insured employers' security that got deposited with the commissioner has been exhausted. That's the short answer.
So this is an exhaustive list of those.
Yes, they are old claims, but because that security that was originally deposited by that employer has now been exhausted, the commissioner is charged under 342.920 to actually pay those claims. And so there's a fund established in 342.920 that actually provides the money for that.
Okay. So it's a $4.4 million. Is that just for the administrative expense, or does that include some of the claims?
No, that includes the pass-through money going to the injured employees.
Okay.
And it's actually an overinflated number. For the past, I've been since about 2012-ish. I would say the payout has been more like $1 million to injured employees, and the cost to actually administer the claims varies on which claims they have to touch. So every time they touch a claim, there's a charge, and right now it's $39, but it's been less than that in the past. So when the administrator actually touches a claim to pay a bill or whatever they do, they charge us, like I said, right now it's $39, and then if nothing else happens for 3 months, it goes closed, and they don't charge us anymore for that claim. So it's kind of misleading, but we've always been told because that money, in essence, passes through that TPA, we have to include it in this contract.
Right, understood. All right, thank you. Very educational. That's all I have, Mr. Chair.
Senator Douglas.
Thank you very much, Mr. Chairman. I guess then I would follow up with a question that was similar to what Senator Meredith had earlier. We've got a limited number of entities that are being covered, correct? We're not anticipating any increase in that.
Well, I should say yes. And the reason I would say yes is, again, I'm going to get in my long answer a little bit, okay? If you'll give me half a second. Every employer in the state of Kentucky either has to have a policy of insurance or be authorized to self-insure. We're talking only about self-insured employers. And we have both currently authorized employers and formerly authorized employers. All of them had to deposit security with the commissioner. including the former ones. The former ones still, we maintain that security, that letter of credit, that bond, okay? So what happens if they were ever a member of a guarantee fund, and I know this is going to be long and convoluted, and I apologize. If they were authorized to self-insure on March 1, 1997 or after, they were automatically a member of one of the 3 guarantee funds. So when one of those employers defaults and that security gets called, that money goes to the guarantee fund to administer all those claims. If that security money proves to be insufficient, then what they do is that those claims get divided up between those that were pre-March 1, 1997 and those that are on or after March 1, 1997. The March 1 and later claims all get paid by the guarantee fund. They assess their own members to pay those claims. The pre-March 1, 1997 claims then come back to the commissioner to get paid out of this fund established by 342-920. And I'm sure that was clear as mud, but that's how it works.
No. Actually, the scary part for me, it is clear. I've
Yes.
worked in this space. My question is, if we're not really expecting a large increase in the demand, why does the contract amount not change?
Well, because we don't know exactly when that's going to occur. A lot of them are coal companies, so you've got lung transplants that may or may not occur. So we want it to reflect what's possible, but what's not always been the experience.
And Senator Douglas, I would add to that, again, sorry, that they do involve all the coal companies. And that a lot of the time we're talking about pneumoconiosis of black lung that doesn't develop for quite some time. And when it does, for instance, a lung transplant costs $1 million. And they fortunately, do not have the greatest success. So when that does happen, we have to have the funds in order to be able to cover that expense should it occur at that time, so as to cover that amount. But we've traditionally been running about
$1 million
a year.
A little over sometimes, a little under sometimes.
Thank you very much. Thank you, Mr. Chairman.
Motion approved.
I have a motion by Senator Meredith to approve. Do I have a second? Second by Representative Rourke. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Senator Douglas,
Aye.
Chairman Hart.
Yes, motion carries. Thank you all so much for being with us.
Thank you. Congratulations again, Senator.
The next items on the pull list are with the Department for Disability Determination Services and our numbers 52 through 85 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record.
Good morning. My name is Stacy Kane, and I'm the Commissioner for the Department for Disability Determination Services.
Good morning. Wesley Phelps. I'm the Medical Relations Branch Manager for Disability Determination Services.
All right, thank you all so much. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you all so much. And Senator Meredith.
We'll continue the theme to plead legislative ignorance, just trying to figure out how this works. You've got a multitude of contracts here. Are each one of these for an individual?
Yes.
Are each one of these either an MD or a DO?
An MD, a DO, or a psychologist.
Okay. That's a substantial salary. How's that determined?
So the funding for these contracts do not represent a payout that we give to the individual vendor yearly. They sort of set an upper limit or a budget for the maximum amount of work they'll do. So the way that they operate at DDS, these are our medical consultant contractors. When an adjudicator, that's somebody who's making the determination on a claim for disability benefits. When it comes time to determine the maximum amount of work a person's capable of doing from a medical perspective, Social Security's regulations require that a doctor complete that assessment and sign off on it. So when the adjudicator gets to the point where they have the evidence collected and they need that assessment completed, they create a referral for those doctors. So these contracts are structured so that the doctors are paid a fee for each referral, and that total amount for each contract represents the total amount we would pay out in a year. The vast majority of our medical consultants do not do that. That's a lot of work. That represents a lot of hours. Many of these reviews take an hour to 2 hours to complete individually. So a lot of our folks are working part-time while they maintain a practice full-time and may only do, 40 cases a week or something.
So good explanation, but I still don't understand why we set it so high, 768,000.
Well, we've got a great deal of work to do currently. Workload numbers for us. This is from the fiscal year 26 budgeted workload. Our total number of cases that were budgeted by Social Security to work are 83,194. Some of those cases will have complex interactions of impairments that are physical and mental, and those require review by an MD and by a psychologist. So in a lot of cases, each of those individual cases can represent between 1 to 3 referrals total. So we set that total amount to make sure that we cover in the state of Kentucky as many of those referrals as we can.
So do you actually have a physician that will make $768,000?
No. We have 2 that get close every year, but the vast majority of them do not complete that much work.
For the MDs and the DOs, what's usually their specialty?
Well, because Social Security trains all of their medical consultants, we expect them to review cases that have impairments from all body systems. We like to recruit internists because they have familiarity with all body systems. But we do also have an ophthalmologist. We have a couple of pulmonologists for when the internist feels like they need particularly special focus on a body system like that. They can refer to them.
Well, looking at just family medicine right now, I think the average salary is around $260,000. So I would think y'all wouldn't have any trouble recruiting people, do you?
Well, typically no in terms of the money, but some physicians will begin work for us and then find that it's not exactly what they expected and it's not really what they prefer to do and will discontinue work for us. There are also federal requirements that you have to go through. All of our medical consultants have to pass through the HSPD 12, the presidential background check process. There's a lengthy questionnaire, there's an investigation, they work with an investigator. We have folks who don't want to participate in that.
I appreciate the explanation, but I still have problem following the logic of all this. It's not calculating for me, but I don't have any questions, Mr. Chair.
Anybody else? If not, do I have a motion to consider the contract review without objection? A motion made by Representative Rourke, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Unfortunately, I'm a no.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Senator Douglas.
I'm going to vote aye, but I'll need to explain my vote.
Go right ahead.
Mr. Chairman, and I think this is at least the third or fourth time during this particular committee meeting, I think we really have to start taking a better look, or at least a harder look, on some of the inflation in some of our budget requests. And the words may or possibly, or we have to prepare for, we're going to have to get some of those words out of our vernacular, because I don't think our taxpayers can continue to afford it. I think that we just need to be a little bit more accurate in some of the calculations that we make. And I guess sometimes, Mr. Chairman, I get a little wobbly when I look at asking our taxpayers to continually pay for poor decisions that people make. I don't know that it's the taxpayer's responsibility. I think sometimes our public has to endure, may need to endure the results of the poor decisions that they're making, and perhaps that would be a stimulant to stop making those poor decisions. So, thank you, Mr. Chairman.
All right, thank you.
Chairman Hart.
Yes, motion carries. Thank you all so much for being with us.
Thank you.
Thank you.
All right, the next items on the pool list are going to be with the University of Kentucky, and our numbers 202, 207, 223 through 226, and 234 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record.
Good morning. My name is Barry Swanson. I'm the Chief Procurement Officer for UK.
Good morning. Rob Edwards, Vice President of Strategy and Government Relations.
Good morning. I'm Craig Collins. I'm the Chief Financial Officer for UK Healthcare.
All right, thank you so much. We're going to look at Contract 202 first, and I have a question on that, or a couple. Was this contract competitive? Once again, was this contract competitively bid and followed the normal routine procurement process?
Yes, it was.
All right, and is this work a continuation of the earlier contracts?
Yes,
it is.
Okay. How much have we already paid them, or what do you anticipate also paying in the future?
Sure, I can take that question, Representative Hart. At this point in time, we paid them over those past contracts, and there were actually two PSCs that were submitted in the last biennium, but in total, we paid close to, up through May, we paid about $91 million, or through April, I should say, about $91 million. The majority of that was towards the project that we came forward with the implementation of Epic and Workday and SailPoint for our current community hospitals that have become a part of the university in the past couple years. We also had a project that we tagged along with this that was the implementation of Epic to one of our partners, the Rockcastle Hospital, so that they now can have access and use Epic as part of their daily business and continue the opportunities for us to share medical records across the Commonwealth.
Okay, thank you so much for that. What services will Deloitte provide over the next 2 years for the $125 million?
Sure. So the majority of it is to continue the final implementation process of this large project. We actually go live with the Epic project here at the very end of the month of June, and then we go with the additional application with the ERP system in the July and August timeframe. What they bring for us is they're our implementation partner. They bring to us some skill sets that we don't have within the university information technology team on really how to make sure the connectivity, that we make sure that we have the security around those patient records. And also, as we've stood up the IAM system, that SailPoint, that expands over the entire university to make sure that we have a safe environment and that we are not attacked with some cybersecurity events that we actually had years ago within the university. And this is to try to bring in that protection for those new entities and also for our existing entities.
All right. That's all the questions I have. Is there any other questions pertaining to contract number 202? Go ahead.
Thank you, Mr. Chairman. I'll continue to beat a drum that I've been beating for a little while. We have some absolutely wonderful institutions here in the Commonwealth, including the University of Kentucky. Really, really smart people. And I continue to wonder sometimes why we go to outside entities to do consulting for our academic people who are always telling us that our universities stand out. So I think there may be some room for a conversation to be had between some of our teaching institutions and some of our legislative institutions about how do we best serve the people of the Commonwealth, and how do we best make sure that the tax dollars are being utilized to their maximal amount. So I think those are conversations that we need to start having.
We welcome that. Yes,
All
sir.
right. All right. Before we move on, do I have a motion to consider contract 202 that was just reviewed without objection? I have a motion by Senator Thomas. Do I have a second? second by Representative Rourke. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Senator Douglas.
I would explain my vote.
Go right ahead.
I just say aye with the hope and the expectation that down the road we'll all be able to sit down and start having those conversations. I still worry about little silly things like infrastructure, like workforce participation, like gas prices, like social services. I still worry about those things. And I kind of take a look at the monies that we have to move one way or the other, and especially the healthcare space and what's going on in our healthcare space. And I really appreciate what you guys are doing. Thank you very much, Mr. Chair.
All right.
Chairman Hart.
Yes, motion carries. Thank you all so much. Now we're going to look at contract number 207, and it's on, let's see, and I've got a couple questions. One, I was curious about why the consulting for this contract was not able to be covered in the contract we just talked about. Could you maybe just explain a little bit?
Yes, sir, Mr. Chairman. YCAP does very specific consulting in the behavioral health space. We've been looking at, as the incidence of severe mental illness increases in our patient population, how we might better serve those patients, and YCAP has a specific capacity to consult in that space.
All right, thank you for that. Also, yeah, you've heard this asked several times on this committee, but I'm going to ask it again. I noticed that we're contracting with an organization out of Minnesota. Is there no healthcare consultants in Kentucky?
We do competitively bid all of these opportunities and try to find the highest value for the skill set that's most needed. And we continue to look in the state both for team members on our staff and for consultants. But in this case, the highest value we found for the responses was YCAP.
Okay. And, we get very vague descriptions sometimes with the contracts. What is this? Can you maybe explain a little bit or expand on what the specific purpose of this contract is?
Thank you. Very specifically, as we are expanding Chandler Hospital on our campus, we have a behavioral health unit at Good Samaritan Hospital. And between what we're building at Chandler, what exists at Good Samaritan Hospital, our relationship with the state at Eastern State Hospital, and the community mental health system in our community, how do we best organize that to serve patients? So, for example, we've recently implemented a outpatient intensive therapy called Empath, and how does that play into the overall care and cost of patients?
All right, thanks. And one final question, and this is kind of going off of what Representative Petrie said earlier. Maybe can you give me your thoughts on what's something that we can do as a legislature, as to create the pipeline to maybe attract more vendors in Kentucky to do this?
I think specific to the earlier conversation, we're very excited to participate with the University of Louisville and Eastern Kentucky University in the response to SJR 116, which asked us to come together and work on new pipelines for healthcare professionals, specifically physicians. A lot of that you do with training residencies at community hospitals in rural areas, and the data shows that that's a great way to increase the pipeline to keep Kentuckians in Kentucky.
All right. Thank you so much. Is there any other questions? If not, do I have a motion to consider the contracts reviewed without objection? I have a motion by Senator Meredith, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith. Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool. Representative Rourke.
Aye.
Senator Douglas.
Aye.
Chairman Hart.
Yes, motion carries. And the last group of contracts with UK will be contracts numbers 223 through 226 and 234. And I believe Chairman Douglas has some questions.
I do, Mr. Chairman. I specifically want to address contracts 223 and 224, if I may.
Hi,
Hi,
could,
Senator.
Could
Yes.
you please identify yourself?
Yes, I was
before-
about to. Thank you. I'm Shannon Stamper, Deputy General Counsel at the University of Kentucky.
All right, thank you. Would you please raise your right hand real quick?
Yes.
Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. And
Thank you.
Senator Douglas.
Thank you very much, Mr. Chairman. And again, I want to echo something that our Chairman Hart has said. I have no idea what these two contracts are for.
Okay.
Help me out.
Sure.
And I do want to reiterate, I'm pretty good at reading, but I just I know there's sometimes people are worried because we look in the legal space, but we look in the engineering space, and we look in the healthcare space.
Mm-hmm.
We look in all the spaces, but I'm trying to learn more, and my people want me to know. Well, what is this legal aid for? That's just simply a question.
Yes. So, as a large, complex organization, we have over 30,000 employees. We have, help me and my students really quickly.
38,000 employees, 32,000 students.
38,000 employees, 32,000 students. Locations all across the state. We have not only our locations in Lexington, but we are among the state's largest employers. We are an employer in all 120 counties in this state through our extension service. So we are all across the state. As with any large organization such as ourselves, we frequently deal with a lot of different legal matters, including litigation. We frequently get sued a lot. That's just the way large organizations are. Most of these contracts are geared toward litigation. We come to you every 2 years. We are not always knowing what will come in the next 2 years that we will need the litigation assistance for. So much of these contracts that we bring to you all, including this one, these
or
two,
at least these two, yes.
These two, yes, correct. These two deal heavily with litigation.
Okay.
And there are also other corporate matters that can be done when we have complex corporate matters. So we do have a very large in-house legal staff. When I've been with the University of Kentucky's legal office for 13 years now. When I started, there was about 10 attorneys across campus. We are now at 25 because we have tried to bring everything in-house as much as we can. Some of that's because we expanded. You know that our legal office, it serves as legal counsel for UK King's Daughters in Ashland and UK St. Clair and Moorhead. So we have expanded in part as a reaction to that. But we have also tried to bring in as much non-litigation work in-house as possible. And we also do have some litigation attorneys even in-house on our staff. So we do as much as we can with that. So one reason, and we can be more specific going forward, totally understand the types of things. I can tell you that Stites and Harbison in 223 does, among the litigation things they do a lot of medical malpractice work. They were already existing mal counsel for UK King's Daughters when UK and King's Daughters came together in their partnership. But we also already had contracts with Stites for other purposes. We have used them occasionally for healthcare transactional purposes off and on over the years. We have used them very extensively lately to, when we did our dorm project in 2011, 2012 with our campus dorm partner, Stites helped us do those initial round of documents. We were then able to do a lot of those subsequent dorm agreements in-house because of the work that Stites did for us at the beginning of that. So we were able to use what we had and move forward with that. There are other corporate things they do. And then also Stites does a lot of intellectual property work with our Office of Technology Commercialization, assisting the university and our faculty with patent work and other things. Some of that is because there was another small boutique firm that we used to use for some of that work, including also some of our athletics, copyright protection work, trademark protection work. And that firm, those lawyers dissolved that firm and went to work for Stites and Harbison. So there's a myriad range of many different things that Stites and Harbison will do with us. Stoll, Keenan, and Ogden, very similar. We've used a lot of their healthcare corporate attorneys there off and on over the years. I know you have also pulled another contract. I will be candid with you. There is an immigration attorney at Stoll, Keenan, and Ogden that the university has used for university-sponsored visas for its employees as well. They're also Stoll, Keenan, and Ogden. Sometimes we have used them when we've talked about our Coldstream development and other developments. So.
Okay. Thank you very much. I think it's difficult for us sometimes to simply say, or to simply read, cannot obtain the services of specialized legal service matters. And I know there are a lot of specialized services. I mean, there are specialized services in medicine and every place else.
We're happy to be more specific going forward.
Yeah.
We do, and we always will want to have a catch-all because these are larger firms. We do have an advantage. Of course, they're based here in Kentucky. And we have, so we're using Kentucky firms that do have a lot of expertise in many different areas. And so we do want to access the contract when we have new matters come up that may be unusual that we don't have the expertise with.
Okay. Thank you very much. I appreciate that. Thank you, Mr. Chairman, for those two.
Senator Meredith.
Just a very brief question.
Yes.
This is in the professional liability space. If you see on this committee, you see we approve millions and millions and millions of dollars in legal fees and consulting contracts, but specific to professional liability.
Yes.
Would tort reform mitigate some of this?
I believe there have been attempts before on tort reform, and
Good answer.
Yes.
I was baiting you a little bit, but thank you.
Thank you, Senator.
I didn't hear an answer.
Yeah.
I heard a statement. I'm sorry. I missed the answer.
I said I know there have been attempts at tort reform, and he did
Okay.
not let me go further. So.
Okay. All right.
Is there any other questions? If not, do I have a motion to approve contracts 223 through 226?
So moved.
I have a motion by Senator Meredith, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourks,
Aye.
Senator Douglas,
Aye.
Chairman Hart.
Yes, motion carries. And the final contract for review is contract number 234. And Co-Chair Douglas, I think, has some questions on that.
I do. Thank you, Mr. Chairman. And that was a pretty good lead in. Help me out in explaining this contract because I have, if I may, I will likely have a few questions.
All right, go right ahead.
Yes, I'm happy to explain this contract. We, as a large organization, there can be positions, very specialized positions that the university has throughout, for which the university may not be able to find enough qualified personnel in the United States. And in those positions, the university is willing to sponsor H-1B visa petitions for very qualified candidates who come from abroad. This is used heavily sometimes in the healthcare space with physicians, and there's other of course programs as well for healthcare as well, J1 waivers, Conrad waivers, et cetera, J1s and Conrad waivers. But also it can happen in other situations as well. It actually can happen in athletics at times. We might have a particular sport where we feel like it would benefit the university to have an international reach and some international expertise. Soccer comes to mind when that comes up. I will also let you know, so this particular law firm does business as Ware Immigration. It is a well-known national law firm in the immigration space working with higher education. It was founded by an attorney named David Ware, who I have met at college and university conferences all the time, a number of times, excuse me. he later sold his firm to some other group of attorneys, which is where the Sun Sovereign name comes from. They just create a new legal entity, and they get to use his name and the reputation he built with this. And so they do operate on set fee schedules. That is the same as our Still Keenan attorney. Immigration attorneys work on fee schedules. Really, this contract with Ware, however, this is work that we have actually tried to move in-house when we do need these services. 2 years ago, the university did hire someone in-house to assist with these immigration needs. That person also provides some invaluable general guidance as universities do navigate administration changes in immigration policy. That's been very helpful for that. So all of that we're getting from in-house work. This contract is really still on the plate because we do have some current employees who used this firm when they obtained their initial H-1B visas or similar visas. Sometimes these people do O-1s, which is for outstanding work. And so we want to retain, it's difficult to change counsel in those situations if they need to do that. And yet it is technically an employer-sponsored application, and so the university is obliged under federal law to sponsor it and to pay the legal fees for it. So,
with all due respect, I know we're running along here.
Yes.
And I apologize for interrupting, but I do want to move through some of the questions I had. And you've already mentioned the H-1B one, and we also talked about the J visa.
Yes.
What percentage of students at the university are getting these visas? Any idea?
Those two programs are not for students. The student visas are F1 visas for them to come in, and this law firm is not for that.
So they're not doing anything with the F1 visas.
They are not doing anything with the F1 visas. I sometimes have asked for general advice on changes in policy. That is rare from time to time, but they do not do the actual work that is done in-house.
Okay, so they don't have anything to do with the Form 551s or the other forms, correct?
I believe no.
Okay.
My caveat is that I have in-house people who know those forms better than I do. So if I've misspoken, my mistake.
That's
But we
okay.
have
You
in-house
can
people
send
who
them to
know
my
the
office. We'll
forms.
have I am more than happy to have a conversation in my office about about some of these.
Of course.
Because there is an H-1BJ that is for the physicians. Now, what happens when that physician leaves the university?
When a H-1B employee, physician or otherwise, leaves the university, whether it's voluntarily or involuntarily, they separate from service. We notify USCIS that they've left. And under the current visa rules that have been in place for a long time, these have not changed. Those individuals then have a 60-day grace period under federal law. If they are looking to, if they voluntarily leave, you would have thought maybe they have found another job, a new employer to sponsor them. They have 60 days to essentially change all that order over for them. So they have a 60-day grace period. If we were to terminate someone for bad performance, that is, fortunately, that's rare, but it's not impossible. Same process. We say we have to let you go. We notify the feds. It is now on them to see if they can get another job and another sponsor, and they have a 60-day grace period. And then at that point, it's between the feds and that individual.
Okay, because one of my main concerns is, again, I'll go back and say we have law schools here in the Commonwealth of Kentucky, and we have some really, really good, and it's hard for me to say as a physician, attorneys who are doing really, really wonderful jobs. Okay, and I'm always looking at these. The idea that the people that we're training can't handle the specialty areas, and to me, it's counterintuitive. I'm sorry, it just is.
Senator, I totally understand your question. I do want to say in some of the other contracts, we have people who have been trained at UK who are doing that work, and Still Keenan comes to mind with that. This particular law firm sometimes has dealt with some unique situations. Sometimes you're dealing with people who already started with a firm at a different part of the country and they're used to it. I will be candid that this firm we're really using for these legacy employees and legacy work. We are actually not sending any new work to this firm. We would prefer to work with people in Kentucky. What I'll also go ahead and tell you is that we do actual RFPs for this every few years. We are due for that new RFP in this coming biennium, and we will make a big effort to advertise that to local attorneys here, because there are local attorneys who, to the extent we need someone outside to do this immigration work, we're happy to use them. And of course, we already do have in-house people. We are having in-house people to assist with those issues when our employees need that.
And I won't volunteer any more of my colleagues unless they'd like to be volunteered. But when that process starts, I would love to have someone come by my office so we can have a conversation about this.
We'll
about
be
this
happy
area.
to do so. We are using this to get through the next 2 years, and then so we're doing a new RFP in this biennium. My colleague on the other end of the table and I have already been discussing that calendar. So.
Okay, because there are some reservations, but I want to make sure those reservations get satisfied.
Sure.
All right. I'll have more questions down the road, Mr. Chairman. Thank
All
you.
right. Do I have a motion to consider the contract reviewed without objection?
So move.
All right. Motion made by Senator Meredith, second by Senator Thomas. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke.
Aye.
Senator Douglas.
All right. I want to thank you for answering those questions, and I really look forward to some conversation down the road.
Happy
Thank you
to,
very
Senator.
much.
Thank you.
Chairman Hart.
Yes, motion carries. Thank you all so much.
Thank you.
The next item on the list is with the Attorney General. If the representatives would come forward and identify yourself for the record. It is contract number 4 on the routine MOA pink list.
Mr. Chair, while they're coming to the table, I'd like to offer, we're getting late into the meeting time, and there are going to be some other obligations, but one I requested be pulled is contract 167 under the personal service contract list. And I anticipate that could be a lengthy discussion. As much, I'd like to make a motion to defer that contract if we can.
Okay, I have a motion by Senator Meredith to defer contract number 167. Do I have a second? Second by Representative Rourke. Can we take this vote? All right. While he's getting Senator Thomas, would you gentlemen please, so we can expedite this a little bit, go ahead and identify yourself for the
Yes,
record.
good morning, Co-Chairs Hart and Douglas. Will Schroeder, Senior Counsel for Attorney General Russell Coleman.
Good morning, Chris Evans, Executive Director of the Kentucky Opioid Abatement Advisory Commission.
All right, thank you, gentlemen. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
Thank you all so much. As soon as we take this vote, we'll get right to the questions because I know we're all on a.
And Chairman, as we're waiting, if it helps, I know because we have KT viewers, and anytime we're talking about opioid abatement funds, I always like to remind the viewers or anyone in the audience that this is not taxpayer dollars that we're talking about here today in this contract. This is the result. This money is the result of settlements from typically the opioid manufacturers.
Let me interrupt you real fast, Mr. Schroeder. I've got a motion and a second. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Aye. Representative Bauman. Representative McCool. Representative Rourke.
Aye.
Senator Douglas.
Aye.
Chairman Hart.
Yes, thank you so much, Senator. And contract is deferred until next month. This time, Senator Douglas has some questions, but if you'd like to go ahead and finish your statement before.
That's pretty much it. I just wanted to remind the committee and anyone watching. Thank you, Chairman.
All right, thank you. Senator Douglas.
Thank you very much. Thank you, gentlemen. Sorry you've had to wait so long. I know it's a long morning. Just two very simple questions. One, why a company out of Florida? And let me couch that with my second question, which is simply that we have a huge number of rehabilitation clinics here in the Commonwealth, and it's interesting to hear that we're going to another state to look at something that's a youth-focused prevention initiative. So help me out with that, if you would, please.
Absolutely. Thank you, Senator. Again, as we've briefed the body before, this portion of this organization is providing services in regards to that youth prevention program. The Attorney General tasked us with scouting the country to identify a program that best fits and works in the Commonwealth. What we were able to find was this program, which was unique in terms of delivering content to Generation Z through social media, streaming programs in a way that wasn't being done anywhere else across the Commonwealth or across the country. That is what led us to that organization in terms of identifying and finding what we could use to deliver content to youth in Kentucky. So that is an individual organization which has unique properties and unique trademark identified information which we could content and deliver. For us to try to find something similar in terms of the Commonwealth, we would have had to start from scratch, look to see a whole new program and build that, where we found something that we were readily able to take and implement across the Commonwealth.
And therefore, that was a concern I just wanted to express, in that we know along our area, this is a huge issue, and we look at other states and see what they're doing, and then we start utilizing their services year after year after year after year after year, as we've already mentioned a little bit earlier. I would like to have some conversation early on once we have an opportunity to see whether or not this particular program has really any positive effects. Just because, as we know, just because a medication works for one person doesn't mean it's going to work for someone else similarly. Whether we could have conversation about developing something here in the Commonwealth.
And Senator, so far we have seen very positive reflections from the people we're targeting. The minors that we're targeting have reached out. And so far, by all indications, I think it's been a successful campaign.
Absolutely, Senator. I think that's the thing, is we will continue to look through part of this next phase, and what we will be doing is monitoring the operations and taking an evaluation of it to make sure that we're putting forth the best product for the youth. We are delivering content where it needs to be delivered in the way that it needs to be delivered. So that is part of what we're trying to make sure we do. And also I want to highlight that although the company is out of South Florida, a number of the work and a number of the portions of the things that take place, the videography, the work that's being done with youth, is being utilized through Kentucky-based companies. So I want to make sure you understand that we are making sure to do that wherever we can to insert the ability for companies and work in the Commonwealth to take place.
Well, thank you very much. We do understand that now.
Yeah.
I didn't understand it before because I didn't have access to that particular information. I will continue to pound the drum that until we start holding our caregivers more responsible, a lot of this won't make a lot of long-term change. And I only say that because I've only been in the healthcare space about 46, 47 years. So I've seen things develop over time, and we continually need to look at the not just who's in the pipeline, but how they get the pipeline, and how do we narrow the entryway or the number of people who are coming into that pipeline. And so I thank you for that information. I just want to make sure that Kentucky is also on the forefront of developing these programs, not just picking up programs that other people have started, but developing our own programs that are going to hold people accountable and help move forward with, especially with our children. So thank you very much for I'm sorry for your wait, but thank you for that information.
No,
Thank you for the opportunity. Come explain it. Thank you.
All right. If there's no other questions, there will be no, we've lost our quorum, so these contracts will move forward without a vote. But we do appreciate you all coming and explaining and helping us understand it better. Thank you all so much.
Thank you.
The next item on the pool list is with Eastern Kentucky University, and is number 87 on the routine PSC green list. If the representatives could come forward and please identify yourself for the record.
Mr. Chair, again, while they're taking their seats, is there any prospect of regaining our quorum?
No, not today.
Well, to that end, contract 65 under the personal service amendment list.
Okay.
Well, we can't make a motion on this either, but this one needs some discussion and would like to see it deferred, but I don't know how we do that now.
We'll check and see if Senator Thomas can come out of where he's at.
Well, that end, to kind of expedite just a little bit, I'll make that motion, and if it can be in second, then we can be
All right.
waiting in anticipation.
And I'll second that motion as well. But while we're waiting for that to be figured out, let me go ahead and turn the floor over to you guys. If y'all would just identify yourself for the record.
Yep, Jordan Smith, Eastern Kentucky University.
Hi, Dana Full, General Counsel at Eastern Kentucky University.
All right, thank you so much. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, nothing but the truth, so help you God?
I do.
All right, thank you so much. And I got one question here. Is this the only legal contract EKU has that would provide representation for immigration matters?
Yes, it is.
Okay. And how much did EKU spend in the last biennium for these services? And it don't have to be exact if you can just give us an estimate.
I don't have it by biennium, and I'm a lawyer, so I don't do math, but I certainly have it by fiscal year.
Okay, that'll work.
For fiscal year 25, $48,000. Fiscal year 24, $31,000. So this is another circumstance where, in an effort not to have to come back to this body on the contract multiple times, we have tried to estimate a little bit over what we anticipate annually needing.
All right, and one last question. In the recruitment of faculty and students, how much, if any, is the consideration of domestic versus foreign when you're...
So that's a significant requirement for us. It's also, just so this body knows, a requirement of even federal immigration law, a certain way you have to post the positions to make sure you're considering current U.S. citizens. For us, this is a blip of our employee population. I think less than 0.5% of our full-time faculty are with us on some immigration sponsorship, and we anticipate that likely slowing down even in the future given changes at the federal level with additional fines and fees that are associated with this work.
All right, thank you so much. Senator Douglas.
Thank you very much, Mr. Chairman. Again, I'll ask some similar questions, but do you deal with any of the H-1J1?
Most of our J1s are done for students in-house with a student immigration office. If there's a really unique situation, we may call this law firm for just advice, but that's a rare occurrence. For the most part, Stoll helps us with the H-1B filings or continuations.
Do many of the J1s get offered employment once they've completed their education?
Yes.
How is that handled?
There is a handoff between our current international student office, it has a new name, and then to HR, and then using this immigration services contract, we'll work to kind of hand those students off.
I'm just trying to figure out which visa then we then move to, because we're really not looking at an H-1B1. What are we looking at when that switch goes over? Because we're really looking, we talk a lot about H-1B1 and we talk a lot about different immigration visas, but just one second. I like to do a little bit of my homework, but the H-1B1J was primarily for physicians. I'm just trying to find out what they fall under, whether we're just looking at a regular H-1B1 visa at that time.
And this is part of why we contract for the expert service, because this work is so unique and specialized, but there's a extension of a period of time they can work under the J, and then obviously would have to apply for a full-time position that would be eligible for sponsorship for the H-1B sponsorship. I just don't know, and would be able to get that to you, kind of what that window is from the J to the next type of visa.
Yeah, because then we're moving from a lawfully admitted for permanent residency and a conditionally permitted for permanent residency, and I'm just trying to find out how our universities have been handling that over the years, because the initial one. There's a 10-year validity period, and the conditional is a 2-year validity period, and I'm trying to figure out whether or not the taxpayers are continually paying for legal services to keep people in this country, or certainly in this Commonwealth, and that shouldn't be on the taxpayers' back. So I think likely I'll need to have a conversation as well with Eastern Kentucky University in my office at some point.
Sure.
Okay.
Happy to do
Thank
that.
you.
Yeah, we can do that.
Okay.
All right.
Mr. Chair, thank you.
If there's no other questions, your contract will move forward. Thank you all so much for being here to explain it to us.
Thank you.
Thank you.
The next items on the pull list is with the Kentucky Community Technical College System, and our numbers 132, 134, 135, and 136 on the routine PSC green list. If y'all would please come forward and identify yourself for the record.
Jessica Stegall, General Counsel for KCTCS.
Make sure your green light's on. There you go.
Jessica Stegall, General Counsel for KCTCS.
Blair Hess, Vice President of Marketing Communications for KCTCS.
I'm Becca Korosek. I'm the System Procurement and Payables Director.
All right, thank you so much. I've got a few questions. The first one, excuse me, is in regards to item number 132. This contract provides funds for legal services for a variety of matters, both for to KCTCS and employees. I think I understand the intent, but can you help me by explaining the scope of the contract?
So McBrayer is current outside counsel and about 4 members we have with pending litigation. To be honest, we went out on RFP and they are not accepting new work. So this is just for the continuation of those 4 litigation matters, and that is all that work will be used for.
Okay. And my one other question is in regards to items number 134, 135, 136. I understand the contract covers all of your campuses. Help me understand, with enrollment at a 10-year high, why is there a need for aggressively advertising instead of maybe investing the money in classroom or other needs?
Sure, thank you. So I would say that we believe that the enrollment being at a 10-year high is largely thanks to part of these efforts. You mentioned we have over 70 campuses across Kentucky. We have a lot of various audiences that we have to reach. And in doing so, those audiences are a little bit unique to other universities. We have, an open access policy, so we take all students who apply. About 30% of our students are not college ready when they come to us. And so the messaging that is required to reach those audiences is a little bit unique and requires a lot more steps to that. We're also handling access to all 120 counties in our bordering states, and doing this on behalf of all 16 colleges. 16 colleges determine what levels of marketing and advertising that they need based on their enrollment needs, because those vary across the state.
Okay, and just one little quick, I think, simple question. Why was there a need for 3 contracts versus maybe just one contract for all of it? Or
Yeah, sure. So the first one is for all marketing services. So what that's going to be is buying media, helping us place it across the state. We have one for just video services. It is much more cost effective to have an external firm do video services across our state than try to employ it at all of our 16 colleges and cover the type of mileage that we would have to do that. And then the third contract is for public relations. So
Okay.
it is for crisis communications. Again, over 4,000 employees, over 120,000 students. We're preparing for anything.
all right, well, thank you. Is there any other questions? If not, go right ahead, Senator Douglas.
Thank you, Mr. Chairman. I wanted to make sure that I didn't mishear something, if I may. I thought I heard the statement that said 30% of the students are not college ready when they come. Did I mishear that? I'm
Yes,
sorry.
just under 30% of students who come to KCTCS are not prepared for college.
I don't think we have a graduation rate like that out of medical school, where we can go out and practice if we're not ready.
Well, so we are an open access institution, which means if you apply to KCTCS, you're in. So it then is our responsibility to meet the student where they are to try to get them college ready. So we provide that sometimes means a GED if they need it, or that means some remedial classes to get them up to the level that they need.
Okay. And that's in statute. Or what do you say we are? Who's we?
Our 16 colleges are open access, yes.
No, I'm not trying to make this difficult. I really am
No,
trying
sorry,
to
I'm just-
understand. 'Cause,
Yeah, all of our 16
people know when someone says they and we, I kind of go, okay, who are we talking? Who are the they and the we?
Sure. All of our 16 colleges are open access. So if you apply, you're already accepted. Our application's free and you're enrolled. If you need some remediation to help get you up to a level in which you need to get into these classes, then we provide that as well.
Okay, thank you.
If there's no other questions, thank you all for coming and thank you for your explanations.
Thank you.
The final item on the agenda is number 65, and without the presence of a quorum, we are unable to defer the item till next meeting. We have 45 days that we are allowed to consider the contract, so we can keep it open for discussion. What's your all's? Okay. Then so the final item on the pull list is with the Kentucky Communications Network Authority and is number 65 on the PSC Amendment Ivory list. If representatives would please come forward and identify yourself for the record.
Good morning. I'm Jim Barnhart, Executive Director, KCNA, and CIO, Commonwealth Office of Technology.
All right.
Morning. Adam Adkins, General Counsel, Kentucky Communications Network Authority.
All right. Thank you, gentlemen. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you all so much. And just to remind you, this is for discussion purposes only. So, Senator Meredith. Or Senator Douglas, I'm sorry.
I'll be glad to go first.
Either way.
I didn't discuss as much as my disappointment that we have to defer action on this contract. And, you know, I've been on this committee longer than anyone at this table. And I've seen this contract every year. And it's always increasing. And it's the reason we don't challenge it is that it's ongoing litigation. And the question I'd have is, how much longer is this going to go on? We spent close to $2 million on this litigation. It's not moved anywhere at all. And now you want an additional $1 million, or ICE wants an additional $1 million? How can we justify that to the taxpayers? And one of the explanations given to us is that it's for expert witness testimony. There's no court order for expert witness testimony. So how do we justify that?
Sure, I can address that, Senator Meredith. We do have a trial date now. It is in November of 2026, so we should have resolution finally to the litigation. Expert testimony in litigation of this complexity is pretty standard course, particularly given the unique nature of the Middle Mile Network. So we actually have
your microphone closer.
Sorry about that. I'm generally very loud, and so I try not to get too close. We do have a trial date in November of 2026, so the litigation will see an ultimate resolution by the end of this year. With that stated, we also have a court-mandated mediation at the end of July. The hope is that the litigation concludes prior to trial, and the parties are able to come to some sort of settlement. With regard to expert testimony, it's a very complicated and unique area of law and of litigation in the Middle Mile Network, and expert testimony on interpretation of that contract is necessary.
If you think there's a chance that we won't go to trial because this thing may be settled, why didn't we settle years ago?
I think that's a fair point, but why doesn't everything settle sooner rather than later? We made an effort at settlement prior. It was unsuccessful. The court has ordered us back to mediation. Again, I'm going into it with the best of hopes that it settles.
Well, I understand that the justice systems move slowly more than we would like, but this to me is inexcusable as long as this has gone on, that we haven't made any further progress in this, and there's never been any motivation to do it because we're stuck. What happens if we don't get a settlement or for some whatever reason it doesn't go to trial? Do we come back next year and pay them another $1 million?
The court has said in its most recent order, and I'm happy to provide it, that the November 26th, we originally had a trial date for the end of this summer. We had a trial date for this summer. Given the ongoing discovery with it, the court moved it to November, but made assurances in order that it would not move again.
Well, apparently this is going to be your lucky day because we have no choice but this contract go on. But I think that it's really placed a burden on the taxpayers of the state that we're going to have $2.8 million that we should have never had to spend. And again, it's your lucky day because we can't vote on this. If we could have, I would have made the motion not to approve this contract. But this is truly inexcusable. And we approved dozens of these legal contracts. It's costing the taxpayers just millions and millions of dollars that we could use other places. This is unconscionable. I don't know why we let this continue as long as we did, but somewhere it has to stop. And I'm embarrassed by it, and I think this law firm should be embarrassed by it, and anybody involved in this should be embarrassed by that. Taxpayers of the state are getting nothing out of this whatsoever. Everybody that's profiting from it doesn't deserve to profit from it, but it's inexcusable.
Thank you, Mr. Chairman. I have to echo some of the sentiments that Senator Meredith has expressed. I suppose that if we were to cut the reimbursement for those who were involved in the litigation, that this would be settled a little sooner.
I would disagree. I would think that it would probably end any chance of settlement. Obviously,
no. You can disagree.
Sure,
you can disagree all you want, but it is inexcusable. I'm not blaming anyone at the table. I'm simply saying that the taxpayers expect people who are educated, who are reasonable, to act like adults. And in my review of the case over time, that's not what's happened. I hope that the deadline in November is it, not just for this committee, but also for our taxpayers who are funding. I too wish we would have the opportunity to have voted on this contract today. And I guess I would hope that anyone who's involved in something such as this in the future would take the time to say, perhaps we need to be a little bit more aggressive in trying to settle this and think more of the taxpayers than some of the other things that generally cross people's minds. That's all. I'm not here to admonish anyone. I just want people to think of who is actually footing the bill for this continued litigation and who actually cares about the litigation. So that's all I want. Okay.
Senator Meredith.
Senator Douglas is much kinder than I am and much more polite than I am. I'm not going to give anybody a pass on this. Everybody has ownership for it, and one of the problems we have with state government is nobody takes responsibility for anything. It's because it's not their money that they're dealing with, and it's easy to look the other way. Even Judge Shepard said in his remarks that we spent over $1 million on this, and we've got nowhere. I wonder if we should consider maybe legal malpractice against the firm that's handling this. Is that a potential? And if so, can we recoup some of those dollars this way? I think that's something we certainly should explore. But anybody who's had their hands on this, you're culpable. You're part of it, and it's inexcusable.
Any other comments, questions? Okay. If not, gentlemen, thank you for coming, and your contract will move forward.
Thank you.
Thank you.
Senator Douglas.
Thank you, Mr. Chairman. I'll try to make this as quick as I can. You know, at our last government contract committee meeting, I asked someone in the education department because to come and have a conversation at my office. Essentially, we were looking at social studies for K through 12, and I had some concerns and some questions. I received an email from that office, essentially stating that I want to share the information below and offer a phone call to Senator Douglas. With all due respect, Mr. Chairman, I didn't ask for a phone call. If I wanted a phone call, I would have asked for a phone call. We are elected by the people of the Commonwealth of Kentucky, and I want the people of the Commonwealth of Kentucky to know that your senators and your representatives do try to follow through. We are in the legislative branch, and we're dealing with our executive branch, which has been challenging at times. I sent an email back to that office that day, in fact, that morning, saying that I wasn't interested in a phone call. I was interested in setting up a meeting in my office. And I have yet to hear anything, and that was May 19. So my concern here is that in the legislature, we are trying to work with this executive branch that has thrown multiple challenges. But I want our people of the Commonwealth to know who is on their side and who has their backs. We're supposed to be working together as co-equal branches of government. But that only works when all the branches are willing to step in the door and say, let's work together. We just saw a classic example here with Kentucky Wired. As Senator Meredith has already said, nobody's willing to take responsibility. Well, I'm going to start calling out. I'm not going to let it go either. If we reach out and no one wants to respond, it is our job to inform the public of who's willing to participate and who isn't willing to participate on the playing field. Thank you, Mr. Chairman.
Thank you for that. Before we adjourn, our next meeting will be July the 8th at 9 a.m. and that will be a Wednesday. So that's going to be a little bit different, but a Wednesday, July 8th, 9 a.m. in this room, and co-chair Douglas will be chairing that meeting. So, anybody else have any comments?
We have a change in date. I'm sure staff will do this, but let's send out an early email to make sure we inform and just emphasize how important it is for everybody to be here.
Yep.
There is, wanted to make one note. There is another interim joint committee scheduled at the same time that day.
Oh, at 9 a.m.?
Yeah. It's local government.
Local government's been changed to 3 p.m.
Great. Great news.
So, because I checked on that.
Lovely.
I checked on that earlier.
Perfect.
So,
I'll
yeah.
be here.
So, you just have to stay longer. Anything else? All right, we stand adjourned.